You're listening to Health Professional Radio with Wayne Buckler. Today my guest is Chris Tanti, CEO of Headspace, the National Youth Mental Health Foundation from Melbourne, Australia. Hello Chris and welcome to Health Professional Radio.
Hi, how are you?
Very well, thank you. Chris, tell us a little bit about what Headspace is and what services you provide.
Well, Headspace essentially is an early intervention service for young people aged 12 to 25, and what we know about public mental health services really, at least in mental health, is that we wait for people to become really sick before they get access to care. Headspace sort of turns that on its head in lots of ways. And the way we think about illness is that if you intervene early, then you minimise the chances of other secondary problems or problems secondary to the main presenting problem occurring. And so the whole idea with Headspace is that you bring a whole range of services together, and they take a pretty broad perspective of the needs that young people present with. So we know that young people, in terms of the prevalence of mental health problems in this age range, the majority of mental health problems emerge during this age range. So mental health is a clear area of speciality. We also know that drug and alcohol issues are prevalent. We know that young people are thinking about the future, so vocational, educational issues are important. And we also know that young people need access to primary care. So GPs and primary care and sexual health and a whole range of things are also available in Headspace centres.
Now, Chris, I mentioned in the intro that you're in Melbourne, Australia, but what geographic footprint does Headspace service?
Well, we're essentially right across the country. We have, we're in every state and territory. We have 83 Headspace centres currently open, and we are expanding to 100 by mid-next year. So by July next year, we should have 100 centres open around the country. In addition to that, we have two other programs, one called eheadspace, which is an online chat service for young people, and the other program we have is Headspace School Support, which works primarily with secondary schools trying to prevent suicide, but also in the event a suicide occurs in a secondary school, we have a service that comes in and works with the school system and their networks to try and minimise copycat suicides, etc. So it's a fairly well-developed network around the country, and in fact has just recently been adopted in Denmark and Israel, and will probably be much broader than that over time.
So is Headspace, for want of a better word, an Australian invention, or is this something that began in Australia?
Yeah, absolutely. It did begin in Australia, and I guess the work of Pat McGorry has really largely informed the idea of Headspace, and Pat probably is the most influential person in early psychosis, in the early psychosis field, and has certainly been influential globally in terms of the way we think about the provision of services to young people presenting for the first time with a psychotic disorder. This sort of expands on that idea, and we, I think much more broadly around the presenting problem, and take a primary care view of mental health in the sense that the majority of people that have mental health problems and go to their GP will probably experience depression and anxiety, and certainly that's what we're seeing in Headspace. The majority of clients that we see have depression and anxiety and will come in for sexual health checks and issues around bullying, etc. But we also, as well as that, in addition to that, get some fairly complex presentations too.
I see. Now, Chris, many of our audience work in the health industry. We target health professionals, but I made the mistake when I first started this job of believing that everyone who worked in the health industry knew everything there was to know about the health industry. And as I've gotten into the role, I've discovered, in fact, that many people don't know what's happening in the ward next door, let alone the rest of the industry. What is it that you'd like health professionals to know about Headspace?
Well, I think what I'd like them to know, and there's been a lot of public, there's been a lot of media around Headspace recently, and in lots of ways, everybody would like Headspace to be what they think it needs to be. Headspace is not really a service at the more complex acute end. And so there are a lot of people who argue that Headspace should be the more complex acute end. But prior to Headspace 9 years ago, there was an obvious gap in the system for young people who experienced mild to moderate mental health problems. Headspace is designed specifically for those clients, for those young people. And so there's a bit of a misconception within the community about what it is that we're trying to do. We are not duplicating the existing public mental health service system. We are creating a new system of care that supports practitioners in primary care, but also links into those other systems in health and welfare for those young people most at risk or those more complex young people. So it's sort of bolted into the system, but it has a completely different orientation, if you like.
I see. Now, is there any referral necessary here, or do people just front up to Headspace if they need your services?
Yeah, well, that's the beauty of it. It is a completely open system. The majority of young people that come to us, just walk in the door. They're self-referred, if you like, or they're referred by their family. Yep. So that's about 60 to 65%. They don't need a specialist referral to come in. And I think the other important thing about our Headspace centres is that every one of them has a youth reference group, and nationally we also have a youth reference group. And I think what that has helped us achieve is a sort of environment that is much more relevant and user-friendly for young people. And so the demand for our services is pretty high. And I think that's really about how we engage the consumer in the design and delivery of what it is that we do.
And Chris, is there a cost for this?
There may be some out-of-pocket expenses for young people or their families when they come through, but generally it is extremely low cost or no cost at all. We try to minimise the cost to the consumer because we know that young people, if they're having to fork out, will not fork out for their healthcare. They have other things to do with their money. So we don't want to, and generally those things are important, as I'm discovering with my own son, but, that they will not prioritise their health. And so if we start to impose a cost, we know it's going to be a deterrent.
Yes, that's a very good point, and I was chuckling, not to be derogatory about youth prioritisation of money, but just fondly remembering my own youth many years ago. Chris, if there's a misconception about Headspace that keeps you awake at night, what would that misconception be?
Well, I think that it's the criticism of our organisation recently has been, well, we don't have the data, we don't have follow-up studies, we don't have long-term evaluations, and all of that is a misrepresentation of the truth. And so that's the thing that keeps me up at night. That how do we let people know what it is that we're doing? How do we think about attracting funding to do long-term follow-up studies? And there are a whole lot of ethical issues involved in all of that. We are primarily funded to provide clinical services, and last year alone we saw 54,000 young people. In some areas where we have Headspace, the referrals into our Headspace centres outweigh those to public mental health by a factor of 7. So there's very good uptake with services. Wow. It is difficult, though, to be clear about outcomes, but what we know is that the majority of young people that are coming to us, rate us 4 out of 5 in terms of satisfaction with service, how they feel when they leave the service, etc. And we also know that most young people, the majority, are arriving very distressed, in a high period of psychological distress. So we are seeing the right people, I think. I think it is a very good service. I think the community is getting good value for money, and before this, this service didn't exist, and I think this is why it resonates right across the world, because that there's a one-size-fits-all approach to mental health. So basically, if you have a psychotic disorder and you're at risk, then you might get a service within a public mental health system. This doesn't require you, Headspace doesn't require you to be seriously at risk. It requires you to just identify, or your parents identify, that you might need to talk to someone. And sometimes those problems are fairly significant, and other times, with an adult perspective, they might feel insignificant. But we do know that young people will kill themselves because they're being bullied. We do know that young people who are same-sex attracted are 4 times more likely to take their lives. These are serious issues that young people need to process, and so that's what we're here to do. We're here to help the young people process some of these things that, with an adult perspective, might be fairly simplistic and inane, but actually, from the experience of adolescence, from someone who has very limited experience in life, they can be quite pronounced.
Chris, it's been very good to chat to you this morning. You've certainly cleared up some of my misconceptions about what I thought Headspace was, and I like to think of myself as reasonably well informed in the health space in Australia. So thank you for that. How do people get in touch with Headspace?
Look, the best way to get in touch with us is through our website, and that will detail all the phone numbers of the various Headspace centres right around the country, the locations of those Headspace centres. And so it's www.headspace.org.au or eheadspace, www.eheadspace.org.au. And that's the best way to come into the system in terms of working out the lay of the land and where the Headspace centres are located.
Chris Tanti, thanks for your time today. It's been a pleasure chatting with you. For listeners who have just joined us, or maybe you're reading a little transcript, there is in fact a transcript on our website. It's at www.hpr.fm. We also have a SoundCloud archive of this interview, or you can find it on a variety of other services, including YouTube. Chris, it's been lovely having you with us. Thank you for your time this morning.
Thank you for your time. I've really enjoyed it.
This is Wayne Buckler on Health Professional Radio.